What drew me to medicine, one was to have the technical expertise and have the surgical knowledge to be able to address a problem directly. Once I got to my cardiac training, I think I found that I was interested in adult cardiac cases, but also interested in some of the aspects of cardiothoracic transplant. There's a benefit in a cardiologist and a surgeon seeing a patient from each of the two different perspectives and then combining thoughts and weighing the concerns on each side together carefully in order to come up with what's the best plan for that particular patient. One of my main goals is to find out a little bit about what their journey has been through their symptoms or their disease process. I always like to get into a very detailed deep dive into a patient's other medical conditions and what other medical problems are, because that can weigh heavily in our making a proper decision, either a transcatheter therapy versus a cardiac operation for that patient. The most rewarding part of my job in the big picture is playing a part in guiding a patient in their pathway from having a defined medical problem through the procedure of whatever that procedure is and addressing that problem. On the other end, coming out of a procedure or surgery, making sure that everything is done perfectly so that they can have the best chance possible to get the maximum quality of life out of that intervention. On the lung transplant side, patients do come from around the country and in some cases from other countries to benefit from what our team can offer. Sometimes that is a willingness for us to tackle a case that has some surgical barriers. In some case, there's a combination of medical and surgical complexity that makes us qualified to address those issues. And I think at the end of the day, I think that's one of the more rewarding things that comes out of my participation on that team is what we can offer as a group.